Thursday, and since I promised three streams a week for you guys, this is me on a second stream this week. I got crushed, smashed at BJJ practice yesterday. I'm feeling like crap. Still, I have to report a lot of MRI and CT scans. We are already at the 12 mark. I have reported a set of 12 MRIs so far, a few CT scans also, and we still have about 23 to go. Let's see. It's fine. Connection seems fine. Just going to share the screen. Screen has been shared. I have a brain scan here. Brain scan. Just fixing the position of my chat screen here. Yes, it's here. I don't know which scan is this. Oh, this is the scan. So let's go. This is a 72-year-old female. She says she has some memory loss. It's a brain MRI. They did the hippocampus coronal T2 sequence. And let's go for a sagittal T1. Where is the sagittal T1? This is it. Sagittal T1 and a axial T2. Why not? Right there. So axial T2, there is a lacunar infarction right there. There is some hyper intensity areas around the ventricles on the basal ganglia region. Quite normal. Let's see. Indeed, some lacunar infarctions, lacunar ischemic lesions right there. Maybe on the pons too. Yes. Tiny lacunar ischemic old lesions. And there is a mild dilatation of the supratentorial ventricular system. Nothing major. Let's grab this is a T1, axial T1, which is not necessary by itself, but since it's here, let's just roll the images and look for any bright spots that could point us to acute bleeding. This is also very easy to see on the FLAIR sequence. Where is the axial FLAIR? Give me axial FLAIR. Axial FLAIR is here. It's a T2 sequence with an additional pulse that saturates normal fluid. So brain fluid is black, and anything that shines should be disease. So there is indeed some lacunar ischemic lesions and some microvascular disease, although this is a very noisy sequence. So much noise, probably related to a bad state of the coil. Coil must be an old, worn out coil, and it gets this much noise, which hides small lesions, as you guys might be thinking. It doesn't help, it just makes things harder to diagnose. So let's go for a diffusion weighted sequence, see if there is any signs of a acute ischemic stroke. No signs of an acute ischemic stroke. Let's grab a SWI sequence, a susceptibility artifact weighted image sequence. This is shaky and noisy because we are dealing here with a poorly maintained scanner for sure. There are some tiny sites of blood product or calcification deposits or some other kinds of mineral deposits right there. See, there too. This is quite normal. Let's check for there is a inversion recovery sequence. Oh, freaking shaky. Oriented towards the hippocampus and the amygdala. So there is a slight reduction in size of the hippocampus. It's unfortunately a very badly done sequence. It's too thick. They made it so, as thick as any other sequence, so it's crap. See, we should have at least 2 or 3 consecutive slices showing us the dentate gyrus or gyrus, but we don't because it's a low resolution, too thick of a low resolution sequence with slices way too thick, way too not as thin as they are supposed to be. But as far as I can tell, there is a slight enlargement of the ventricular horns and of the choroid cistern and kind of a flattening of the dentate gyrus or gyrus, especially on the left. So this is MTA2, and the FLAIR says to me it's in Fazekas 1 classification, tiny spots of bright gliosis. There is no contrast enhancement, so we have gone through everything we could possibly report on this exam. I'm just going to copy and paste my template because I have a template almost exactly